Well, hello. Thanks for joining me. Today I want to give you hope for COVID-19. You know, we don't want to sit around and just worry about it and feel like we're out of control. That's one of the biggest stressors, and stress is a horrible thing when it comes to susceptibility to disease. So I want to tell you about an interesting study that was done in Spain. They started noticing back in March that people who had diabetes had a higher risk of mortality, of death from COVID-19. They started measuring blood sugar. 100 different hospitals in Spain measured the blood sugar of people who were admitted for COVID-19. And they looked at people who were not previously diagnosed necessarily with type 2 diabetes. They just measured their blood sugar. They found that they considered below 140 to be low, between 141 and 179 or 180 to be moderate, and above 180 milligrams per deciliter to be high blood sugar. This is the news you can use. This is the hope that I hope you can really grasp and I can adequately communicate to you. What they found is that people who had blood sugar above normal died at a rate of almost 2.5 times those who had normal blood sugar. Now, that was not necessarily people who were diabetic. There was no difference between people who were diagnosed with type 2 diabetes or who were not diagnosed. And that in fact, about 19% of the people in the study were absolutely diagnosed with type 2 diabetes, but many of those still had lower blood sugar because they were controlling it with diet, medication, or both. So this is news you can use. So what do? You want to know what your blood sugar is. You can get a glucometer at the drugstore, just about anywhere. You want to measure your blood glucose. You want to know what it is early in the morning, and you want to know what it is later at night. And also, you want to assess just where the high sugar items are in your diet. It's so easy during this time of stress to stress eat. I mean, it's the easiest way to comfort yourself, but you want to know what you're doing because you don't want to wait till you get to the hospital before you have problems. The thing about a high blood sugar is that it's sort of an inflammatory bystander. And there are many things that are comorbidities that are considered inflammatory bystanders when it comes to susceptibility to big problems with COVID-19. I mean, things like heart disease, high blood pressure, things like gum disease, I mean, even bleeding gums. Those are inflammatory bystanders. And that seems to be what the factor is here. So you want to know what you're eating. You want to enjoy your life, but you want to intentionally enjoy your life. If you're going to have some sugar, eat it slowly. Enjoy it, but maybe couple it with some protein. If you're going to have some chocolate, have some nuts also. You want to think about upstream measures that you can do. Obviously, we're all doing all we can to not contract COVID, but I think it's very counterproductive to sit around and worry, oh, what if I get it? What if I get it? What if I get it? You want to do things that you can do to decrease inflammation that will help you if you get COVID. So I hope this gives you hope. When you go to your physician for your physical or any test, you'll be getting your A1C done. Now that's an average of your blood sugar over the past 3 months. That's an important number too. Type 2 diabetes has many problems. Many people are undiagnosed. So you want to know, you want to be proactive. This is your life. You want to enjoy it. You're the boss of you, and this is your vehicle. So thanks for joining me. You can do it. You can make the changes you need to do. I'll help you.